Welcome back to part two of our lesson on Benadryl. In part one, we spoke about Benadryl and its uses and the unfortunate misconception that you can use Benadryl to get high, or that Benadryl combined with pain medication will cause some random euphoric effect, none of which is true. Benadryl will make you sleepy, it'll make you drowsy, but you are not getting some sort of fun LSD Burning Man like trip off of Benadryl. I don't care what it's mixed with. As I was starting to say in the last video, uh, IV Benadryl, if not handled correctly, can be very dangerous for the patient. And this is something that I learned, unfortunately, last August. So what you see over here is my leg, and that scar down at the bottom is a scar from an ulcer that I got that was caused by Benadryl use in a gravity IV from Home Health. So, Home Health came and they put an IV in my leg. It was a great IV. As I said before, the IV was running at 300. So that's 300 drips an hour, which is very fast and kind of unheard of for an IV that's not a pick or a port. So, needless to say, I was happy and very impressed. But something that I began to notice was my nurses would come, they would give me my pain medication. All was good. Of course, my pain medication would make me itch, it would turn the area red. And just like with Benadryl, IV pain meds sting. They sting, especially when the IV is older and the vein is the vein wall is being kind of, lack of a better word, eaten away at. And you can trace, you can feel where the medication's going. And so that's why you use the Benadryl, right? And I just, on a side note, it's so important that we use IV Benadryl after or before these medications, because the more sensitive the patient is to the pain meds, the closer that IV is to the surface, like if it's in your hand or just a vein that's just laying on top of your arm, the older the IV is, and depending on how much of the vein walls have been eaten away by just having the IV in it, you can get some serious hives and whelps, and sometimes even like pustules underneath the tegaderm. So that's the plastic that you see over that blue line there. That's the catheter going in my leg. And so what happens is we itch closest to that entry point, and that entry point is covered in plastic. So imagine the heat, the whelps, the hives, and unfortunately sometimes the pustules, as I said, like bumps that form underneath that plastic. And if you scratch at it long enough, two things happen. One, you easily rip open that tegaderm, and now you're allowing germs to come in. But two, you're scratching at the site, and you're scratching at bumps that have stuff inside of them. And now all of that is mixing and mingling and having a really fun petri dish party right next to a hole that's going directly into your vein. And that there is a very good start to a not so great infection. Okay, but back to this Benadryl. So I have a rule that Benadryl is always last. It's always last. Um, I have it for many reasons, but my main reason is because the nature of the medication. So being an antihistamine, when you inject Benadryl, its job is to get into your body and shut down all of those receptors in your sinuses and your nose, your throat, your ears, all of those places where you may be having a cold, or you may be having sinus problems or whatever. And so what it does is it wants to prevent those issues from spreading. So it just shuts everything down. And with the IV, the minute it gets into your vein, it shuts that vein off. And everything in your body goes dry. Anything with a mucous membrane, and I do mean anything, goes dry for at least 5 minutes or so. But the interesting thing is that the vein itself contracts and it shuts down. It just shuts down. And I know this because the IV that I had, home health, like I said, it was running at an incredibly fast rate. And the minute that my nurses would push the Benadryl, all of a sudden it stopped. And I watched, and if I was lucky, it did 3 to 5 drops in a minute. Maybe. Most of the time, though, it was like 2. And that's because that vein had shut down and contracted so tightly that the IV could not flow. And so that would happen for about 10 to 15 minutes. And then all of a sudden, the IV would flow again just as quite fast as it was before. So that meant that vein finally opened up. And of course, I would feel the burning of where the Benadryl was going up my leg and my thigh and all of that. Well, the problem is that when it was just sitting in that vein for 15 minutes, it had nowhere to go. And the vein itself, I'm sure, had been worn down because I had that IV for a good week or so. And the Benadryl into the surrounding tissue, which I didn't really pay attention to. I noticed it was red, but it would go away. So like, you know how we are. It went away. Cool. Well, unfortunately, after this happening a couple of times, when they finally took the IV out, all of a sudden I had this hardened, hot bump where you see that scar, and that bump stayed there. And then all of a sudden one day I did my yoga stretches and I felt like a kind of like a popping, and that's when the pressure came. That's when the bump became incredibly sensitive, and that's when it showed itself to be an ulcer. And so I ended up in the hospital for a whole freaking month, 5 weeks. And the reason that all of that happened was because they weren't pushing the Benadryl through the line. Okay, ready for part 3.